This part of this podcast is called Three Simple Things.
Three Simple Things is sponsored by United Health Group, working to close the women's health gap.
So let me just ask you, Dr. Sandler, and we've talked about, sometimes this just happens because you have lungs, as with many cancers. But Dr. Sandler, what are three things you can do to lower your risk of lung cancer?
Yeah, I think if you do smoke, then I think absolutely quitting smoking is extremely challenging. There are resources out there. It is really, really hard. But it is not only your lung cancer risks, it is heart disease, it is other diseases that if you are able to quit smoking, that is one of the very, very best things that you can do for your health. If you do meet current eligibility criteria right now, because either you smoke or you have smoked in the past, please go and get screened. All insurances that are ACA compliant right now should cover that without a copay. So please talk to your doctor and have that low-dose CT done. And then I would say a call to action to talk to the people you love, those that meet eligibility criteria right now, and also do your own research and learn more about lung cancer risk. And we should all be advocating for an opportunity to find this disease early. And my hope is that that is the direction that we are going.
This is my thing about, my dad is actually an infectious disease doctor and a preventative medicine specialist. And so I always think about how often we go to get our hair done or get our nails done, although sure you don't get your nails done, but they look great. But I think about how much time we invest too. And for women too, we see our OBGYN a lot with our kids. Like, why aren't we doing that same kind of stuff when it comes to one, seeing mental health experts, but also just getting preventative screenings? And the insurance industry and the government should support that because on whether it's lung cancer or so many other things, having regular contact with the physician can just improve our lives dramatically, right?
I think I'm very focused on healthcare, not sick care. That's what I always say. Take care of yourself when you're healthy and feeling good. It allowed me to run 6 miles the morning I did that scan, be told I have lung cancer, deny it for a few days, have half my right lung removed, and be back running weeks later. And I think it's because I've always focused on taking care of myself and advocating for myself and being healthy versus only running to the doctor when I'm sick.
I think the reality is the healthcare system doesn't necessarily make it easy for you. And so just want to recognize, for a lot of people have come to me now and said, I want to get a scan or I want to do, you talk about, it's pleasant to go get your nails done. It's pleasant to get your hair done. It's not always pleasant to have to show up to the hospital system and healthcare system. And so I do think
Shira's own surgery was denied.
There's so many crazy aspects here. And so it's just one thing I want to acknowledge with people. It's a fight, but it's worth the fight. And so I think about, the reason why Shira and I came together to do this show and to talk to people is because the juxtaposition of the two of us here tells you the outcome. My sister is not here and Shira is, but my sister would be here if she had been scanned.
But we didn't know. Nobody knew. You guys know everything.
I know.
Brilliant women. It just wasn't, nobody knew.
I've known Anne since I was 20, and we were up to no good in San Francisco. And I watched the Wojcicki girls go through everything, and it was terrible. And that Wednesday, when I got my pathology report that I had an adenocarcinoma, and I thought, I have to call Anne. I didn't know what stage I was. I didn't know if it would work, but it was one of my first phone calls because I was like, who's going to know this better? Who's been through this? It was just a year after Susan had passed, and it was terrible. And then as I did my own research and ultimately wrote the book and started working on my own advocacy, I was like, Anne, we got to do this together. And she was building SWF and everything.
What was amazing is when Shira called me and I was like, Shira, we're going to be that story going forward together. The minute she called, I was like, you found it early and you're going to be okay. And so we will be able to change the world because of this. And so I do feel like that's like a big part of our mission now. Like healthcare and prevention is hard. So we recognize that for everybody. But if you look at what happened with like the HIV world and breast cancer, like look what Susan G. Komen did to change the whole landscape. And so there's an advocacy component. And so I think that's where I look at for anybody who has lung cancer, join the 23andMe lung cancer community. For anybody who's concerned, like go and fight and get your chest CT, because it is a matter of life and death. And there are, you can catch it early and have like a normal, healthy, long life. And so just think of all the important things that you want to be there for, like going and fighting that fight to get your chest CT, like it's worth it.
Yeah.
It's absolutely worth it.
Like I mentioned, I've done this for over 10 years, and I have never been more optimistic and excited about all of the lives that can be saved and all of the positive that can come out of these stories. And it's time to say, enough is enough. This has been the leading cause of cancer-related mortality for men and women in this country for decades. And we now have an opportunity to change that. And we can not only make the research better and make the testing better, but we can change it right now because of what's available. And I think we need to focus on all of the amazing things that people will do after their diagnosis. Because if we find it early and they're cured, you have this entire life after a lung cancer diagnosis. And that's relatively new.